and then we can talk about my neck pain.
I'm happy to do that too. That's my bread and butter. Welcome to Disability Clinic, where we want to reframe for people what it means to live with a disability.
We must be stronger for the road ahead.
We are the strongest political force in this country.
We will no longer allow the government to oppress disabled individuals. And I would appreciate it if you would stop shaking your head in agreement when I don't think you understand what we are talking about.
What we saw at that camp was that our lives could be better.
If you don't demand what you believe in for yourself, you're not going to get it.
I search for
I'm your host, Dr. Stephanie Van. I'm a Vietnamese woman with long dark hair, wearing a gray fleece and a navy top, sitting in front of a colorful bookshelf full of disability advocacy swag. Today, we are joined by Jim Lebrecht, filmmaker, sound designer, disability rights activist, and co-director of Crip Camp, the award-winning documentary about Camp Jened and its impact on the disability rights movement, including the passing of the Americans with Disabilities Act. Welcome to the show, Jim.
Well, thank you for having me here. And I am a older white guy with glasses. I have curly hair and a gray goatee. I've got a kind of reddish shirt on, and behind me is a red wall with a couple of different pieces of artwork, posters, a Crip Camp poster, and kind of poking into frame here is a really nice podcast microphone.
I think you know a little bit about what I do on my YouTube channel, Disability Clinic. It's designed to be accessible, entertaining, healthcare education that is disability conscious. Even though it's been there this whole time, people with disabilities are the best people to learn from. The culture of medicine doesn't quite get it and doesn't know how to learn from the community. I watch movies and TV shows featuring disability. I interview people with disabilities. I talk about healthcare. I talk about media. And I just try to get people more interfaced with the disability advocacy community. I don't have a strict format for the conversation. I do have some questions that lined up that we could kind of just naturally flow through. At the same time, I'm happy to just kind of see where the conversation takes us, because I know you have a lot of wonderful things that you've done in your life already that I would love to talk about. So yeah, I hope this isn't too loosey-goosey of a format.
This is fine. And, the only thing that I kind of require is Crip Camp was a real collaboration between myself and Nicole Noonan. And I just want to never be referred to as the director, but as
absolutely. You are the co-director.
Co-director of the film. And then we can talk about my neck pain.
I'm happy to do that too. That's my bread and butter. It would be an honor.
It's like going to the cocktail party. Oh, you're a doctor. Hey, can you look at the
like, what about this mole?
Yeah,
I get it all the time. But honestly, it's perfectly fine. I don't really mind it.
Well, I mean, I think that we can even talk about pain management. And I'm so happy to be talking to you today.
I appreciate it. Same here. The feeling is mutual. The reason I got into pain medicine, actually, like my base training is physical medicine and rehabilitation, which is such a mouthful. But it really is the medical specialty that deals with injury, illness, disability, impairment. And it's such a niche specialty. A lot of people in healthcare don't even know what it is, or they get the acronym wrong because it's got an image issue, a marketing issue, PM&R. What does that even mean? I kind of wish it was called disability medicine. But the reason I got into it and then I got into pain is because it's so universal. I feel like anyone who comes to my office or approaches me at a cocktail party, if they've got a concern or an issue, I usually can come up with some like, oh, have you tried this, this, and this? Or maybe you should see this type of person. And it just helps me feel helpful to a lot of people, whereas a lot of medicine is very concentrated and siloed. So it's like, if you're a kidney doctor, that's kind of all you know. And then you can't really help someone with a heart issue or a spinal cord issue. If anything, I wish it was not a specialty. I wish it was kind of a general understanding of medicine, because every other facet of medicine doesn't have a good understanding of these human experiences.
But Dr. Van, I actually had 2 negative experiences with PM&R doctors at my local healthcare facility, but found someone finally, another one that is maybe 10 miles further away. So even if you have this specialty, does not mean that their advice or their expertise is not going to have flaws. No one is perfect, but I think I'm being a bit kind here, considering that I believe that part of what happened with one of these people led to a chronic problem that I've had.
Oh no, I'm so sorry to hear that.
Yeah. So, but again, it is being your own advocate and saying, no, both of these doctors you have, I've had bad experiences with, or experiences that did not feel realistic to me. You know, my complex medical situation. I mean, I'm 68 years old. I was born with spina bifida, and my health has been up and down, but as anybody of my age, you know, things are wearing out a little bit. I've gotten this far with my disability. I've never been able to walk. And if I've gotten this far, I'm doing some things right. But those relationships, the ones I've always appreciated with doctors, have been ones that you feel like, work with me here. Don't just dictate or tell me that you know better, but really try to learn from me. And I've got examples of where I've been right about stuff.
You've been right about something about your body that you were experiencing? That's
Go
great.
figure, you know, go figure. And it's like, it's just a matter of, why don't you respect my experience? Or why do you believe that I'm ignorant? And then finding this one other doctor who I like. So I've got somebody I can work with again.
I'm so glad. I'm so glad that you continue to do some shopping and didn't just settle and followed your instincts.
But here's the thing. How much of my ability to do that is my privilege, my ability, my my self-education, and how do we make it easier for those that don't have the means maybe to go an extra 10 miles away because of transportation, or not very savvy. Savvy is not the right word. Experienced in really advocating for themselves. You go to a doctor, you want them to help you. There's this fear that if you push back, then they're not going to care about you. They're just going to discount you.
Mm-hmm.
And then whatever lifeline you had or help has gone away. It's an honest fear. If I push back too much, am I going to be rejected? It's like, if we really push for the best, and, you know, should we be grateful for what we have versus saying this isn't good enough. I don't think we're going to reinvent how the medical profession should work with people, especially folks that are disabled or folks that are multiply marginalized today. But I think that in talking about it, and with the work that you're doing in your YouTube channel, when people see a conversation like you and I are having right now, if they can have an aha moment of saying, you know what, I am unhappy. I don't think I'm being listened to. And yet this guy over here is saying that they were able to eventually locate a doctor that they feel safe with, literally safe with,
Mm-hmm.
and that they can work with, that maybe I can do that for myself, or I can find an advocate to work with me. And I don't know whether that's a social worker at a hospital or, you know, what that might look like. This is why education is so important to me. This is why storytelling is so important to me. Making documentaries or helping to produce other documentaries or even television rom-coms is important to me. It opens up possibilities or ideas for people with disabilities and without disabilities.
It makes those concepts accessible to those who otherwise haven't lived those experiences. I think what we're really talking about is improving access to healthcare. How can we build in the access so that someone who doesn't have as much privilege or doesn't have as much access, how can we make it more automatic so it's not dependent on that individual doctor or that individual setting? And we're really talking about a standard of practice. We need to raise the bar. You're right. We may not fix it today, but I don't think it hurts to try or, you know, brainstorm.
But yet, won't that cost more money? Oh my gosh, isn't that going to take more time. I can quantify with data that if we spend less time or use less people, that less money is being spent. But if you're not looking at the end result, which might be a patient winding up in the hospital for a hospital stay that could have been prevented, like how do you correlate one with the other? Does a medical insurance company or a provider want to look at that when it's much easier to kind of say we save money by not involving as many people for as short of a period of time as possible versus, gee, so many people with multiple disabilities wind up in the hospital or need a lot of medical care. Well, that's just because they have these bodies that are not the norm, the mythical norm.
And there is totally data, blowing that out of the water, saying that even people with multiple disabilities, chronic illnesses, it is not because of their inherent conditions that they're using the healthcare system in more of a treatment strategy instead of a preventative strategy. It's this negative cycle of ableism and fearing bias and mistreatment that keeps people out of doctor's office or just lack of access, such that conditions do get to the point where people are sicker and need more treatment, more interventions. It's a vicious cycle. It's so funny how medicine is like very data driven, yet people with disabilities aren't included in studies. And so, there finally is a big push in research to include data of people with disabilities and their health outcomes. Like the NIH just declared people with disabilities a marginalized health population last year. It's like, whoa, really? I know. I guess it's better late than never. But we're definitely behind when it comes to recognizing like, oh, we've just been ignoring this population. It's not that this population hasn't needed anything or that we couldn't do anything better, but it's just been easier to not think about where could we put some funding to save people's lives and save some money.
Look, this is not surprising to me. Look, so many health studies or medical studies, like we're only really testing men versus men and women, right? I mean, I'm correct about this, right?
Yeah, and we're not testing people of color as much as we're testing people who are Caucasian.
Right, exactly. When you just say it out loud, it seems so wrong, but yet it's been in front of everybody for decades and decades and decades. So again, you come to these isms that are institutionalized. Who's going to push back and risk pissing off some of their superiors or their funders or God knows what else? We need people that can really look at this and speak to it and bring it up, but have the ability to create the change that you're talking about. A year ago that the disabled are considered this category.
Yeah, just 2023. One of the things I always pitch to my patients, especially if I'm meeting them, I tell them like my job here is to be sort of the connoisseur at the winery. I get to lay out a menu of options and explain what's available to you. And I work for you. You get to tell me what you like, what you're interested in, and I help you make the decision. It's that partnership dynamic that unfortunately is rarer than it should be in healthcare settings. That's what needs to happen. That's the shift that needs to happen.
Wow, I really wish I'd hear that. And here's a really funny thing. I do the same thing. So I've had a career as a sound mixer and sound designer for film for decades. And basically that's what I say to filmmakers, especially filmmakers who maybe are working with a sound house for the first time. And I'll give you an example. One of the things that my sound company that I'm still working with, I sold it a few years ago, but we do the thesis films for UC Berkeley's journalism school and their documentary program. It's a very, very quick process for a short film. But what we say to them ahead of times, and really what I would say to any first-time filmmaker that I'm working with is, I am here to service your needs. I am here. Yes, I've got 25 years of experience doing this, but my job is to give you the sound for your film that you need and want. And so I will give you choices. I will, especially early on, I'll suggest alternatives, not knowing whether maybe it's the right thing, but that this is an artistic process that I'm helping you understand what all the tools are, what the palette is here. I think it can be daunting for some people. I'm here supporting you, and let me help you do that.
I get a very similar reaction, especially people who are used to kind of being told what to do with their health. They're like, wait, you're the doctor, like you tell me what to do. And I'm like, we're working together here. You know, you have to get people into that mindset of like, you have control over this situation. And it's a good thing, but it can be a little bit heartbreaking when you realize how many negative experiences someone has had. Like you said, wow, you felt like your doctor actually listened to you. Like I'll get people tearing up in the office when I'm listening. They're like, oh my gosh, you're not just dismissing me. Like you don't think I'm making this up. And I'm like, no. And I'm so sorry that that's been your experience. That's awful.
I mean, you don't think I'm drug seeking? You don't
Oh
think
my
I'm
God, I
making
hate
this
that
up?
term.
I
You
know.
just pushed one of my buttons. Thank you so much for tuning into this conversation. If you want to hear more conversations like this, hit that like button and subscribe to Disability Clinic for more accessible and entertaining education. Thank you so much for watching, listening, and learning.
Rise up, the time is coming soon, and we must be together for the